to Reclaim You. I'm so excited to have my friend and colleague, Erica, on the podcast today. Erica Butler is a licensed marriage and family therapist and a PhD candidate. She is the executive director and founder of Blue Ridge Eating Disorder Care Center. That's a residential program for adolescents in Saylorsburg. It's a new program, and we're so excited to have her in Pennsylvania, running this program, changing the game in eating disorder care. So excited for that, and that you're here on the podcast to talk about families today.
Families are my favorite topic, and I'm a big fan of the podcast. So I appreciate you, my girl, for letting me join in today. I'm really excited to be here.
Oh my gosh, I'm so excited to have you. We've been wanting to record about the role of families in eating disorder recovery and partners, friends, all of the things, right? We're going to generalize by saying families, but loved ones. And you're the perfect person to talk about it. You've been doing this for a long time, and it's a big part of your program. So I'm so excited to dive in.
Yeah, it's such a good topic because I think, families and loved ones in general play such a huge role, but there is a big difference between looking at an adolescent with parents versus someone our age or younger or older with a partner or friends, or what those roles look like. So I think it's a really nuanced topic.
Yeah. Where do you feel like would be a good place to start in talking about this? It's a big one.
Yeah. So I think it probably makes most sense if we start maybe in childhood and work our way to adulthood.
Love that.
Because like I said earlier, I do think it looks different because I'm not leaning on my parents for support the same way that a 15-year-old probably is.
Truth. Yeah.
Yeah. But yeah, I think, I think what I've seen so much from the families that we talk to at Blue Ridge is just not knowing where to start or what their role really looks like. So a lot of confusion, a lot of, do I play good cop, bad cop, regular cop? Is that what you guys are seeing?
Absolutely. And what's the line, and how do I do this without my kid hating me and ruining our relationship? And so stressful.
Yeah. And I think a lot of times, the majority of the work that I do, and so higher level of care, I think it's a really challenging conversation because we're asking you to do a big thing. Send your baby somewhere for, 30, 40, maybe even 60 days, a long time. So I think we're asking a big ask, and not only for the families to do it, but to have their child buy into it. So it's an even bigger ask. So do you feel like it's the same way for you guys in outpatient? I know you navigate higher level of care conversations too.
Yeah, definitely. In outpatient, like having the buy-in from the teen or the young adult, sometimes even to say, I know I need to do this, but I don't want to.
Yeah.
Right. So how do we work with the family? How do we work with our clients to just have a little bit of buy-in to something, like some movement towards something greater than all of this suffering that they're cycling through?
Yeah, I think it can be really challenging, especially for young folks with not a lot of or any internal motivation based on where they're at. And we see it so much. And one of the things that we really try hard to do is, even if you don't have any internal motivation right now, that's fine. We'll go external. It's fine. We'll do, even if it's your phone or, go prom in a few months or whatever that goal is. I think we really have to focus in on what we've got, because I think adolescents, it's hard sometimes to see the bigger picture and it's hard sometimes as adults too, but I really think for adolescents, it's hard to see what the next 10, 15 years look like if you don't find a way to recover.
Oh yeah, absolutely.
Absolutely. And I think a lot of times parents too, there's a lot of misinformation about the seriousness of an eating disorder, especially if your child is in a larger body. I think we get into that a lot, and I think it funnels through medical channels as well. So if the primary care or the pediatrician is not eating disorder informed and there's not weight restoration that needs to happen, that can be really challenging from the family too, because then I and my team are going up against a professional that maybe this family's had a relationship with for years and years. So it becomes like the tug and pull of who do families believe.
Yeah.
It's really
Mhm.
hard.
It
It's
is
a
hard.
really hard battle. But yeah, I think, for families, there's a lot of misinformation about eating disorders. Luckily, I think a lot of great quality literature is out there now. So if you Google eating disorders, I think more
Mhm.
sound research and sound articles do come up. But that wasn't the case back in our day.
Yeah, right? This is new. Yeah.
This is a new development. Or if you go on Instagram, you can find really quality Instagram, recovery oriented Instagrams and resources for families, as there was not always the case. So I think it can be really challenging for families to navigate the messages that they're receiving about eating disorders and their seriousness, and if they can do it at home. I've been seeing a big push for families wanting to do more virtual online,
Yeah.
or virtual PHPs and IOPs, or skip residential altogether. I think it's been a hard climate to sort of navigate for
Mhm.
everybody. And I don't discredit families too, because I always take the stance of families are the expert on their family. I am not, but it's a hard space to navigate.
Yeah.
Yeah.
What's your kind of hot take on teens, adolescents with eating disorders? What's your hot take? Like, what's the trajectory? What's most helpful?
Yeah, what's most helpful? I really think there is nothing better on the planet than a teenager who is connected with some adult. Like, whether that is their dietitian, or they love their nurse practitioner that they see for med management, or you are had the same therapist for a long time and that's your person. That's my hot take. Like, I don't feel like, without anybody in the room that's an adult in the room,
Mhm.
the kid's not going to have a sense of direction. They
Yeah.
have to have some sort of buy-in. And a lot of times when children and adolescents get sick enough to come my way, the parent child relationship is so strange that there
Yeah.
has to be someone else in that relationship. And that's my hot take. It's the
Yeah.
hardest when a teenager comes my way that has no teen.
Mhm. Yeah.
It's like, oh boy, it's really, really hard. And then it's even harder to navigate aftercare,
Mhm.
because it's such a hard transition from residential to PHP, or residential to whatever. It's even harder if you're not going back to somebody that has helped you navigate
Yeah.
prior. That's my hot take. Is
Mhm.
I just feel like an outpatient team works wonders.
Yeah.
And I know, it's probably a hot take from like a residential girly, but I believe it
Uh,
through and through. Like, have a team that you can follow with you, because we're short term.
Yeah.
PHP and IOP are short term. Who is going to be able to follow you through your life's transitions? It's your therapist. I've had the same therapist for 12 years.
Mhm. Yeah.
It's a long haul.
And when families are kind of faced with this, I think a lot of times, especially from the outpatient level, it's like collaboration, of course, with our client, with the team, but also like the
Yeah.
family is also, our client in a way
Yeah.
of mobilizing and trying
Yes.
to support to make these really hard decisions. So what do you see as the parents' role there in supporting the outpatient team and their child to make these big decisions, while also maybe knowing like, yeah, something else has to happen because I'm
Yeah.
worried about my kid. I want them to
Right.
be okay. I want them to be healthy.
Right. And I think what I genuinely like, the outcomes that I see in higher level of care, we see better outcomes when there are families that are invested, that are willing to learn, willing to break patterns that are identified to not be recovery oriented, families that attend family therapy and family nutrition, families that are open to the team recommendations. And open does not mean you can't have questions or thoughts. So I think
Mm-hmm.
I just want to differentiate that. Open means hearing what the team has to say and giving it even a day or two to just think about it. And that's what I see the biggest difference in recovery outcomes, child by child, with similar presentations. The ones that have, long lasting or a shorter length of stay are the ones whose parents are open to the idea of seeking higher level of care when the outpatient team recommends it. The ones that are coming for visits, they want to do family meals, they want to learn. They come to the psychoeducation groups. They're doing their own research. Like there's nothing better to me than when I'm talking to a family and when a mom or a dad is like, well, I read on the internet. And I actually love that because it's one
Because you're
of two
reading.
ways for me. It's either, you found some really quality source that is actually helping you understand something about eating disorders, or it's a great opportunity to talk about what trustworthy sources are and maybe why the resource you found
It's not.
is not accurate, or we could look at it in a different way, or it's, just really not what we're looking for here. So I think I love when families are invested. I love when they read up on it. They try to get books. They are in it to win it. They're solidified as a unit. The families that are more challenging, I think, on my end and my team's end, are that the family that view this as a child only, a person only problem.
Yeah.
This is a problem that my loved one, my child, needs to navigate on their own. I don't know how this happened. I'm not involved. Let me know when she's fixed. We'll pick her up.
Yeah.
That's the hardest for me to navigate because it's a hard wall to break down, that this is we have to treat the whole family, siblings at some level. We try to get the siblings involved. If there is a good friend or there's grandparents that are super involved, everybody in this bubble. So that, I think, for me, makes all the difference, is even just being willing to hear me out. We can have a nice conversation about it. And maybe something, maybe they know something I don't, but at least being open to the conversation, I think, makes all the difference.
Yeah, it feels so similar to us as clinicians looking at the greater system of how eating disorders are manifesting because of weight stigma and oppression and all of those things, that the greater system, and then the family system too, how when people are entering eating disorder treatment, it's like paradigms get flipped on their heads.
Yes.
Right? Like people's worlds are rocked in how they understand relationships with food and body. And that does have to a lot of times be a systemic change within the family unit. So it's sustained over time.
So it's sustained. And that's, one of the things that I always, when I'm speaking to parents, because they often, they want to know what this looks like. I'm dropping my pride and joy off with you, Erica. How do I stay involved? What does this look like? And I say, my program is short term. It's a therapeutic program by design, the ultimate therapeutic place to be, because we made it that way.
Yeah.
Real life is real life. And that's our goal for your child. So that means we need you. We're asking you to do the good family work, the good family nutrition, come in for a family meal to see how here in this environment, we would coach your child through a challenging meal. So when you go home, you know how to do these tools, because I'm only here for 30 days.
Right.
You're in it with your baby angel for the long haul. So yeah, I think it's so important for families to be involved in every step of treatment. Ask questions, get in there with the team. If you're not sure about the higher level of care business, rely on your outpatient team. A lot of times it's like you and I, you have a good relationship with the higher level of care, and I have a good relationship with the outpatient team. So when we make those recommendations, you can rely on your folks that know what they're talking about.
Right. Yeah. And who know your kid and know your family and know, like opportunities for growth or growth edges, and also like strengths of your family and how you communicate or how you support one another.
Yeah. But it's really tough. Sometimes we see parents that are not on the same page, and that can be really, really challenging. And I think one of the things I also always recommend is parents and loved ones to be receiving their own therapy.
Yeah, absolutely.
Always find yourself a couples therapist. If you have a teenager that is needing higher level of care or struggling through an eating disorder, it can take a large strain on the marriage, on the relationship, on the family as a whole. So it's not only your child that is going through a tough go. So we always, it's like once a week, I'm like, I really think that couples therapy is going to help, because I think a lot of times it's just trying to get partners on the same page about a lot of this. And sometimes I can't even say sometimes it's always, dads that are struggling, or always moms that are struggling. It really is a 50-50, but it's hard. A lot of times one parent has an idea about how this should look that doesn't line up with the other parent. And it makes our job challenging
Mhm.
because we're over here in this other circle trying to
Oh,
figure out how your child fits into this.
right.
So yeah, sometimes it's really, but normally I always recommend it for every family to be seeking support ongoing that can follow your family and talk about what it's like to come home and just continue to support long term.
Mhm.
It's hard.
Yeah. What tips do you feel like you have when folks are coming out of a higher level of care back home? Maybe they're doing a virtual PHP, IOP. Maybe they're not doing anything and they're just going back to their outpatient team because that
Yeah,
happens.
yeah, it does.
It sure does. What recommendations do you have for folks who are navigating that and like
Yeah,
heading home? How to re-enter as a family unit into your home setting?
yeah.
It's intense.
It is. It's really intense. So one of the things, stepping down specifically to a partial program or, a higher level of care program, I always recommend, I think, still keeping the outpatient team involved if possible. I know insurance sometimes is really stinky about continuing and having multiple folks and multiple levels of care. If the family is able to financially, I always recommend keeping the outpatient team involved,
Mhm.
whether that's biweekly, nutrition, biweekly therapy sessions, or even just keeping, if finances are a barrier, giving an ROI for your outpatient team to communicate with your higher level of care team is gonna be huge
Yep.
because that outpatient team, again, in a perfect world, has worked with your family for all of this time and can provide so much valuable insight to the higher level of care team. And maybe it would save your child the need to repeat if there's trauma. Saving your child, unless it's a growth fostering
Mhm.
opportunity for your child to speak their truth. And then of course we want them to
Mhm.
do that. But I think there's a lot of times for kids that I've seen, they're like, oh my God, a new team. Now I have to tell this horrible thing I have to start from scratch. I already told Sarah my
Mhm.
story and I have to tell Erica my story. And I get it.
Yeah.
I'm sure it's not fun. So I think that communication is going to be huge. I think that's really important. And I think, really soaking in what the team has to say about those meals at home,
Mhm.
the weekend, the dinners, the snacks. I think that's where sometimes families get caught up and like the team is taking over.
Mhm.
And I love that. The team should be
Mhm.
the team should be holding down the fort, so to
Yeah.
say. But I think one of the hardest challenges that when we are navigating step downs here is the parental anxiety that
Mhm.
crops up. We give
Yeah.
that 3 week mark. All right, we're getting there. Jenny Lusu is coming home. And it's the parents, there's like this excitement because of course your
We're
baby
giving.
angel,
Yeah.
she coming home. It's like good thing. And then it's like, oh. And then there is the past experiences, the past challenges. Oh no, we're going to not be able to go out to eat. She's going to want to do this, that, and the third with meals. Or how are we going to navigate family dinner when I have siblings? And so I think making sure we have a really good discharge plan is always crucial. What is this going to look like? That's why we do our family meals here on site. Let's start getting some practice in. Let's do some day passes with going out to eat with the family. You come back. How did it go? What are we looking at? So I think really prepping for discharge the whole way through is going to be huge. And then continued coordination with the PHP team. If it was a really hard weekend, me as a therapist, and if it was a hard weekend and my child's 4. So, even if it's a hard weekend, like I'm dropping her off at daycare. I'm like, listen, we had a tough go. We had a tough go. We had big feelings
There were
all
lots of
weekend.
big feelings all
Yeah,
weekend.
lots of big
That's a
feelings.
truth in my life.
Yeah, always. If there's one thing's constant, it's big feelings.
Yes. Yes.
But I think, as telling parents too, you're not annoying your child's treatment team when you drop off to PHP on Monday morning, and or even sending an email if things are the hustle and bustle. Hey, Jenny Lou Sue had a tough go this weekend. I thought we were ready to do XYZ. This is how it went. This is what I tried. Can we have a family therapy session? Can we coordinate something? And I think families often struggle with how to navigate with the team and not sure where their place is. So I think I always try to stress when we talk to families that have already sat down, I'm like, oh, you get in there. The teams want you to be involved. So I think that's my higher level of care navigation. Outpatient, it's a tougher go coming back from residential, but I always say we need to beef up. If you're going back, if PHP and IOP are not an option for whatever host of reasons, we have to beef up that outpatient team. How many outpatient sessions can you have in a week? How many, what's your therapist availability look like? Dietitian, same go. Who's your PCP? How often can we get in there for labs, weights, vitals, all of the things? Who's doing psych med management? Like, wrapping that with a nice, pretty bow is going to be everything.
Yeah.
And it's really hard, but we've seen folks really go to outpatient and do the deal. It just is I think a very intentional dance on what that's going to look like. And I think everyone has to be on board with coming home from residential and seeing your outpatient team once a month is never going to be my recommendation. So we have to be very clear with what stepping down to outpatient really looks like. I mean, we're creating probably like a mini IOP just with people that you know, not a program. Thoughts on that?
No, I'm with you. When folks are coming out of residential, and we see it, with adults too, adults who have work or whatever it is that they're not able to go to a program, we get really creative, and we want to like uphold people to be able to like continue at least some momentum and where they were, even if it's a holding pattern. Fine, let's just sink this in and be where we are so that we can at some point move forward, wherever we're going. So creating a mini IOP, meal support, outpatient groups,
thing. Even sometimes a recovery coach.
Yeah.
Like someone that you can like text on the weekends or, whatever that looks like, just any sort of somebody that you can lean on for support. I'm here for it. Yeah. Yeah. Because it's a hard go.
It really is.
It's hard. I think it's just hard on everybody. So teenagers are, I mean, obviously my bread and butter, because that's what I do. And most of the time people are like, teenage girls. I'm like I love a spicy teenage girl. And it's my favorite when parents will call and I talk to them about the assessment process. And they're like, Jenny Lou Sue is not going to be impressed. I'm like, oh, I love it.
Like, that's sweet.
I'm like, darn. But teenage girls, I think it's because I was a spicy teenage girl. But I'm like, it'll be great. We'll have a good time.
Yeah.
We can be spicy together. A lot of times, I mean, I've had a couple folks come my way that we've really had to play the long game. We've really had to play the long game. And I think everyone, when you think about residential, there's this way. I mean, I know Blue Ridge, not to toot my own horn, but is really different in that way. I will play the long game. Bigger facilities don't have the ability to keep beds or to keep spot open or keep anything open, the case open, I guess, for a long period of time. There's been times that I've talked to parents on the side for 2 months, playing the long game, especially as kids get adolescents get closer to 18 or are 18, which is like, you're an adult, but in my eyes, like you're not real. I mean, not really.
Yeah, you're like still a baby,
like,
but you're an adult.
You're still like a nugget to be, just a little nugget. By legal age, you're 18. So I think it becomes a much more complicated conversation with parents, or we see a lot of times parents that don't know how to navigate if their child had treatment trauma.
That's a big one.
And that's a big one. They went somewhere else and it was really hard. It was just not a good fit for whatever reason. I think that's really challenging for families, for not only for them to buy in again, but to have that conversation with their child and navigate that piece. So it can be a really delicate dance to have with the family. And it's a tough go. Sometimes you got to play the long game. And what I tell parents a lot of times is we wait for moments of motivation and we capitalize on them.
And we try to hook in.
And and that's why when I talk to families and they're like, we're just not sure. We just want to get information. Jenny Lou Sue is not I don't know why I keep saying it's just working now. Now it's my catchphrase. Jenny Lou Sue is my girl now. But Jenny Lou Sue is not willing for whatever reason. And I mean, I've never taken somebody into program that's like,
Like, I can't wait. This is going to be
Like,
great.
I can't wait to miss out on school and go and face my fears. This is great. So I think there's a lot of that I just know it's going to be there, the resistance of treatment. But I think, talking to when there's those moments, like setting up for success. So that means really looks like for me that we've done the assessment, we've done insurance verification, and we're just sitting idle.
Mm-hmm.
Just sitting idle.
Yeah.
Because I do think those moments of recovery do come through for these kids. So when we played the long game, the second Jenny Lusu is like, Mama, I can't do this anymore. We've got the bed, we've got insurance, we've done the assessment. Let's move on that. Because we don't want to wait. And I think that's what I tell parents a lot of times. Let's set it up in a fact, and I always tell you too, I'll talk to your child. That's fine. That's fine. If I can absolutely hear what's going on with your child. A lot of times they just want to see that. I mean, not that I'm cool, but I'm not uncool.
You're cool, Erica. You're cool.
The kids here remind me every day that like I got a lot to learn. Like very mindful, very demure. Like, what is that?
I still don't. I keep seeing it. I have no idea, but it's fine.
I think just for like sometimes, I mean, I always offer myself up that like I have a work cell phone that, anybody can call me on, and we can set up a FaceTime. I can walk you around the building and just see that I'm a real person and use humor, but it's real. And how can we work through this? And I think a lot of times that makes a lot of the difference for the families to have someone that they can ask questions, but also I'm not scared of hard conversation with your kid. Your kid's not going to hurt my feelings. I've been doing this long enough that it's all good. I'll be okay. I'm a big girl. But yeah, so I think that that's really important too, is if you are in a space where, you're waiting for those moments of motivation. And I think that works the same for outpatient a lot of times too, for folks. If you're like, I think my 16-year-old just needs to see a therapist, and some days she wants to and some days she doesn't, connect with the outpatient team. And can you just say like, can we move on this the next time she's ready? Can we schedule a session? Can we just like make something happen?
Mm-hmm.
Do you guys ever see anything like that come your way?
Oh yeah, absolutely. All the time,
Yeah.
I mean, teens, adolescents come in and, they don't super want to be there.
No.
I get it. They'd rather be, I don't know, doing whatever teens do.
What the cool kids do. Whatever's
right.
very demure and very mindful.
Exactly. That's what they're doing. That's not what I'm doing, but that's what they're doing.
No.
Because I don't know what it is.
Me neither.
But yeah, and in our practice, I say just all we're doing is building a relationship, right? Like
that's it.
That's it. We're going to create a foundation so that when they're ready, then we start to move in. It's like the dance of readiness and unreadiness. I guess we can look at stages of change or whatever, but like when they're ready, we're going to do a little bit, right? Not too much, because too much is going to send people reeling, whether you're a teen or an adult or whatever, but we're going to just like try to make it comfortable, try to make it human, try to make it as relational and friendly as possible.
Yes. Try to find our inner cool girl. But yeah, no, I mean, I think it really is. It's an art. It's a dance. It's a lot of humor and a lot of naming it to be uncomfortable. And I think that's okay too.
Yeah.
Or this is new, or it's challenging, or it's scary. And I think a lot of times when we talk about eating disorders, even just saying like, I know this is not where you want to be. Like, I know it. Yeah. And to be honest, this is not where I want you to be either.
Right.
Like, I want you to be playing soccer or going to prom or going to the movies or whatever, watching TikTok on your couch, like loud and clear. I want that for you. So can we even connect on the ground level that you don't want to be doing this? And I loud and clear. Because when I was a teenager, I was in therapy and I did not want to be there.
All right. Of course.
No.
Like, what can I do to get out of here? Right. Sometimes that's the thing.
Yeah. Like, what can I, so like we see, okay, fine. If your only goal is to do this because mom and dad said you have to, and you can't go to prom, or you can't, go to the college in California from Pennsylvania, if they can't feel like they can trust you or feel like you're safe that far away without coming to treatment, bet we'll work on that. Let's do it.
We'll work with it. Yeah.
I'll take it. Until we can find some inner motivation of what you want to recover for. I mean, a lot of times we take it day by day here at Blue Ridge. Even sometimes if it's like, I just want to try a bite of this food to add extra phone time in the evening.
Cool.
If you like it, I love it.
Yeah. Yeah.
Like, fine. We have to start somewhere a lot of
Yeah.
the times, and building that rapport where we can, because it's not easy, especially we treat a lot of kids with trauma. It's really
Yep.
hard.
I think one of the hardest parts is really for, like we said earlier, for families, that it's not just your child who's struggling with an eating disorder, or even if
Mm-mm.
you're an adult, right? It's not just you struggling with an
No.
eating disorder. Your entire system, needs support,
Yeah.
because it is such an intense experience, right?
Yes. And eating disorders thrive in isolation.
Yep.
So I think it's this very scary thing for the family, because a lot of times the kids we see just have sort of become reclusive.
Hmm. Yep.
And I think it's a challenging spot for parents, because all of a sudden it comes out that my child is really struggling with XYZ behaviors. I thought they were just being kids and like wanted to hang out in their room and didn't want to talk to me.
Yeah.
Now I have to navigate that my child has had an eating disorder under my roof for all of this time. Am I a bad parent? Did I do this to them? Where have I failed? So then we're navigating this parental shame. And now my kid is struggling so much that this outpatient team thinks my Jenny Lou Sue needs to go to this scary place. The whole thing, it's a spiral. And I think I get it so much that it makes you empathetic to that experience and really try to do it differently, because it's not an easy go. These families are so clearly in distress. It's like heartbreak after heartbreak. And how can we find a sliver of hope that like, it's okay. The buck stops here. You're here. We got it. Like,
let us help you.
Yeah. Like, let's band together. And I think one of the things I say to parents all the time is, you have been doing this by yourself for so long.
Yeah.
Allow me the opportunity to co-parent with you for 30 days. Like, we can do this together. And just what a relief it is. I always like imagine it's sort of like when my mom comes to visit, like my house. I'm like, oh, thank God my mom's here. Like a real adult.
Adult is here to like hold it down for a little bit.
Like the expert has arrived. This is great for me. And she, gets in there. She still wants my opinion. She still wants me involved, but like grandma and my daughter, bestie. So that's
she can hold some of the big feelings for a little while.
It's like,
right?
she
can do
navigate
it together.
That space and do the deal. I almost like view it as like, I'm not a grandma, but like I can be your family's grandma, here to help. So it's just a really tough go.
And one thing that came up for me as you were sharing that is, I know, and there isn't a lot of education about eating disorders, like we said earlier, right? And so a lot of times what we hear, or what I hear on my end of like the outpatient world, is like, I just thought it was a phase. She said, or he said, they said they had an eating disorder, and I thought it was a phase. I thought it would pass, and like, shit, here we are. Like, right?
No, like it's been a year, and now the doctor is saying this, or the team is saying this. That's hard. That's hard. And a lot of times I think our society, and you'll have to rein me back in because I'll soapbox on this, but I will
get on it.
I will try to be succinct with my thoughts here. Our society is obsessed with fitness and healthiness, which is synonymous with thinness.
Yep.
And so I think so many times I have young women, young folks in my office, and they'll say, I just wanted to lose a little bit of weight for X, Y, and Z. Okay. Because that's how it starts. 8 out of 10. That's how it starts.
Yeah.
And I think parents sometimes have a diet culture mindset that they believe that this will make their child happy.
Yeah.
They feel like it is their, like, yeah, absolutely. Everyone, if she wants to have healthy, if you can't see me, I'm Erica.
Yes.
But like these, parents are like, well, I wanted her, if that would make her feel better about herself, or she wanted to start eating quote unquote better, or moving her body more, whatever that looks like. And absolutely, I hear that. And it's a very, very slippery slope.
Yeah.
From that to a full-fledged, now eating and changing my weight, shape, size is my entire life. I cannot see anything beyond that. And I think, it's really hard for parents. I think it's specifically challenging for dads of young women, because I think a lot of times, like my dad is just like, Erica Lee, he just doesn't, I think a lot of times dad, and I see it with my own husband and my daughter, dads are not always sure how to navigate the female experience.
Yep.
And so I think it's challenging for dads a lot of time because they're like, well, she wanted to lose weight. So I'm just here. I'm doing whatever I want to do. So
I'm making her whatever she wants.
Yeah, I'm over here. She wants to have a kale salad. Like, I'm here for it. So I just think
I'm massaging the kale. Yeah.
I'm here. I'm doing it. And I think it's really hard. And a lot of times I think moms can relate in a lot of ways to wanting to change their own shape, weight, size. So there is like this way of a female bonding experience. We've seen that. Well, then it's like, yeah, let's do it together. Like, let's go and do a lot of this. And I think what we try to teach families that I'm very big on is health promoting behaviors that do not impact weight, shape, size.
Yes.
And we rely on our medical team a lot to say that your weight in the overall health pie is nothing. There's so many other things that we are working towards. If that's moving your body in a way that makes your brain feel good because you like it, makes you feel strong, makes you feel energized, whatever it's doing, we love that. If listening to your body after you eat and what that feels like, if you're so hungry, have more. We're just trying to teach like basics here of how we can change the language in homes and in families, because that's really what we're up against. And it's a huge battle to be up against diet culture that is just everywhere and so intrusive and annoying. My 4-year-old was talking about things that were being healthy, and that triggered me because I'm like, where'd you hear that from? Who told you that? Because it was not me.
To end, right?
Yeah, because this is a safe space and I need to know who in your life told you that. But it starts so early. I mean, the other day we had ice cream and she said to me, Mommy, ice cream's unhealthy. I said, my girl. I said, who told you that? I said, ice cream is yummy. Huh? Like, it's good. So I think it's really hard because it permeates.
It does.
Everything. Like, everywhere people have ideas, and there's so much misinformation everywhere on nutrition and all of the things. So I think it's a really tough place for families to navigate. But I always tell parents, you cannot go wrong with All Foods Fit. It's the easiest diet to navigate. Like, so if you want to be a diet family, All Foods Fit is the easiest one for you to navigate because you just show up and eat.
Yeah. And trust that, like, when All Foods Fit, all foods are going to fit.
Yeah. And it's all
it's
good.
going to feel normal.
You like salmon, you like it, I love it. You like McDonald's?
Love it.
Even better. So it's just, I think I tell parents all the time, like, you're on the right track. Do you guys see a lot of that where parents just don't know where to start with food?
Yeah, absolutely. And I think that's where we call a lot on our dietitian friends, from the outpatient side of things, to do some education with families, to read the really wonderful books that are out there now about feeding children.
Yes.
And really just like working together as a unit between the therapist, and often a family therapist, and the dietitian, parents, teen. Our concern, especially when folks are over 14, is like working with the teen. If we don't have a release, we can't work the family. It's a whole thing. It makes it a little bit more challenging, but we really want to support people to understand what a supportive feeding environment can look like for people.
Yeah.
Which, again, it requires for a lot of families, most families, flipping your paradigm about food and bodies on its head and doing a little bit of work to say, like, oh, wow, like, what are my beliefs about food? Where did that come from? Like, what can I let go of even just a little bit to make this a safer space for my kid?
Yeah, that little bit of introspection on where it came, like where those ideas came from, are going to be huge. And then I always tell parents too, I need you to believe your child when they say to you that something that you said or did might have been triggering.
Yep.
I know you didn't mean it like that because you're a good parent who loves your baby angel. I know that. But when they say, Mom, when you ask me X, Y, and Z, it's challenging. And one of the challenges that I offer up to the child is, can you tell your parents what is a preferred method of asking the question? Because we also have to understand parents are under a lot of anxiety. They are so worried about you. So how can they ask? How can they ask if you're back at school and they're desperate to know if you ate lunch today? They're desperate. Mom just wants to know if Jenny Lusu ate the lunch she packed or if she tossed it into the trash. Like mom wants to know, how can mom ask you about that in a way that mom gets her, feels okay. Also, you aren't triggered by mom poking around in your business, that you don't feel like mom trusts you. How can we have that conversation? And a lot of times it takes the child to really say, this is what I want to do, mom. Like, I will tell you. I don't want you to ask me first thing I walk in the door. It makes me feel like that's all you care about. Or, but how can this look so that everybody feels like we're in communication and in a good place? Because sometimes it's just little tweaks.
Yeah.
To get everybody off of the defensive.
Right. Yeah. We all want to be on the same team as much as we can.
Big time. And we see that a lot with couples, not to segue into adults, but I think that one is huge for couples, is the shift from partner to where you're not well is to primary caretaker.
Yeah.
Which is really hard. And then throw kids into that mix. It's hard. It's really, really hard. And, when I was working, with all ages, of course, now we're adolescents, the hardest thing was partners. I think they really, really go through it. I think there's really challenging, especially navigating treatment when someone is a parent and you've got kiddos watching what you're doing at home and what your meals look like or what they don't look like or what you say and what you do. And then there is the quadruple guilt, shame, trifecta behavior thing that goes on. That's really hard to navigate. Do you guys see that a lot working with adults?
Yeah. And it's just debilitating a lot of times, like the shame that can be connected to it because like, oh my gosh, my reason for recovery was maybe my kids. We hear that all the time, right? Like, I don't want my kids to struggle like I have. And how much harm have I done by showing them these behaviors and doing these things and doing them secretly, where shame has also thrived in secrecy in that way. And now my husband and I, or my partner and I, we're not even like relating to one another, and we're not talking, and we're not intimate, and like it just snowballs.
It's really hard. It's really hard because, I mean, if we're going to be realistic, marriage is a tough go at its baseline.
At baseline.
And parenthood is a tough go at its baseline. Add in any sort of mental health, but specifically eating disorders, it's a challenge. It's a really, really hard challenge. And I think, the majority of folks, I think a lot of my information is often biased towards working with women, but I never want to, take away that men do have eating disorders and they are valid and are real.
Absolutely.
But I think from my perspective, the women, the older women that I've worked with, it's been really challenging for them to navigate that experience with their husband. I've seen, folks be separated during treatment because it's just really, the husband is like, I need a break. Like, I need a break. And it's another really delicate dance of sticking in there. I've also had husbands say it feels like parallels to my friends that have partners that are addicts.
Yeah.
And I think, that's really hard too. And how do you make, again, I guess I'll repeat myself, but that role from partner to caregiver parallel is really hard with the defensive end, because I think parents are in a position of power. Like
they are. Absolutely.
They're in a position of power where, like, end of the day, I run your life.
Right. Like, you're going.
I'm paying for your life. I'm paying for this. The parents have a little bit, more power there. As a partner, it takes on this really complicated dynamic of, how do I ask my wife if she ate lunch today?
Yeah.
Like, how do I check in? Because I've seen these behaviors that I saw 6 months ago, cropping back up. How do I handle that? Or the really fun one is postpartum.
Oh.
How do I handle that? Because now I've got a newborn baby nugget and my wife is also unwell. And it's a really, really tough and tricky space. My wife's body has changed. Her mental health is wherever it's at after having a child. And we are all in this really chaotic part of our lives with a newborn. Unwell, unslept, unkempt. Like, all
Disaster.
of the,
Yeah.
yeah, it's a
Yeah.
hot mess after a
Hmm.
child at baseline.
At baseline. At baseline. Throw in an eating disorder.
It's really, really hard. And
Hmm.
I think, I don't know if you guys have seen this, but when I was working with adults, postpartum and after having a child is a really tough time for folks in recovery because even for me, things ain't looking like they were
Right. Yeah.
prior to motherhood. It just looks,
Just isn't.
things are just different. And, especially for folks that had even a, a neutral relationship with movement, the opportunities to move your body in a way or really do anything.
Do
And like,
anything.
yeah, like, even just like go to the restroom or out the window, but like move your body. Are just things are gonna be different. And it's a
Things are so different.
huge transition. Even like meal times are gonna be different in
Yeah.
your family. My child, I don't ever think eats dinner with us at 4 years old because we just rotate Uncrustables, chicken nuggets, macaroni and cheese, maybe
Same.
a hot dog. Like we're just rotating the same opportunities every day.
Yep.
So it's just the whole thing. It's just a really big challenge
Yes.
for parents in the couple unit.
Yeah. Which speaks to the need partners of folks. Really, like the support. The support is huge. The support, like having your own therapist, because you also have needs, right? Like
Yes.
it's so easy to get pulled into meeting the needs of the person that's struggling, which, yes, they
Yes.
deserve to be supported. And so
Yes.
do you.
Do you, and so do you. And I think it's one of the things that I always tell partners is find a group that's just partners.
Yep.
That's just partners. And I think especially if it's someone identifies as male, I think that relationship is gonna be huge.
Yep.
To find other folks because it's such an isolating experience. I can only imagine it feels like I'm the only one going through this. I must have been like, my wife thinks this, that, and that about her body. I must not be doing my job. I think that there's so many shame spirals there that getting around other partners in the similar space is going to be huge to, even be the realization, well, even when I talk about youth out parenting, I'm like, oh, well, Sarah's a good mom and her kids have big feelings. So I think there's a common, a commonality that's very comforting to see another human,
Yeah.
being able to talk about these experiences in a way that makes us feel not alone. I think that's huge.
Yeah.
Yeah.
Absolutely. Yeah. That,
Yeah.
and I think you're right. That connection, even just like our experiences of children with big feelings, right? Like talking to a friend or a colleague who has like a very quiet, mellow, just kind of like go with the flow kid. That is not my experience. They
No. And I'm
can't
like, I love that for
necessarily.
you.
Good. And you can't quite, like, we're not
You
speaking the same language.
Right. Until your Apple Watch goes off, that the sound decibels have hit the roof for the third time today,
Yeah.
you don't get the Butler household.
Right.
And that's okay.
It's okay.
But I think sometimes, especially, being a therapist, it's hard out here being like, my kid.
Whoa.
My kid's the one that, we get the special parent conferences that I always find out that are just for me. Cause I'm like, wow, they're really doing these a lot. Like, they're just
the notes home or the binder or the notebooks and
I'm like, wow, they have great communication. Like they really want to meet with me for like the third time this quarter. Like, wow, we have a lot of conferences. And then I go in and I'm like, so you guys are doing them again? They're like, not for everybody. I'm
not for everyone. Oh, I see where you're going with this.
Okay, fine. Valid. But yeah, I just think there's something so comforting about an experience. And I think that there's such a way to connect with other folks. Like, how are these other parents, caregivers, whoever, how are they navigating?
Yeah.
How are they taking care of themselves? What does their relationship look like with these meal times, intimacy, couples therapy? How does it look like? Do they go with their wives to their doctor's appointments or do they stay home? I just feel like there's something that it's just, you can't get anywhere else from a group of people that have a shared experience.
So true. Absolutely.
Yeah. So that's always my recommendation. Find a group and maybe the outpatient or the family therapist or whoever you're working with. I mean, they can even post on a Facebook group, most therapists are in one to find, to connect with other therapists. post in there. Does anybody know of any, partner support groups, free or low cost or in person, whatever? Get in there and connect with somebody, because I think that is going to be huge.
Well, I could
Yeah.
talk about this all day.
Me too, my girl.
But before we wrap up,
Yeah.
give us the details. Tell us all about Blue Ridge. You guys are doing
Sure.
really, really beautiful
Thanks,
work
Sarah.
up here in the valley.
Yeah.
It's really
Yeah.
exciting that you're here.
Thank you. Yeah. So I will give you the tea on Blue Ridge. So we will be on our year of being open in November. So I can't believe that we are coming up on a year. We opened Blue Ridge in November 2023. I have worked in eating disorders, higher level of care for a long time, and I really wanted to do my own thing. So I was very excited about having the opportunity to open Blue Ridge. So we're adolescent specific. We are gender affirming, and we're really small. So we have 16 beds, but our census has never been over 11. So I think we're a very different experience to maybe what else is out there of like bigger treatment programs that have like a very uniform sort of protocol. We don't. We follow some, we do IMT, integrative modalities therapy for eating disorders, some CBT, emotionally focused family therapy. But I think what's so different about ours is we don't have any sort of one size fit all anything. So we've become sort of this place for families that have a child's presentation that doesn't fit the mold, which they never do. I've never seen an eating disorder show up the exact same way. But we become this sort of place for families that are like, I don't think my child's going to do well in a big facility. We become a place of, my child has a lot of different things going on medically, nutritionally, mental health. We've just really sort of found our niche. We have 24/7 nursing, so we can take, more medically complex kids and get them out of the hospital, which is huge for me. Like, I want you to be in a place like this where you can do the family therapy and the family work and our fun art therapy and have more of a semblance of a life than you would in the hospital. But it has been an absolute journey. It's been a lot of learning, navigating. I've never had a facility that's my own. So even though I've been doing it a long time, it's very different to work with people that this is their thing. You're helping, you're the director, you're this. Being the one-stop shop is it's like, boy, it's a different, it's really, really challenging. There's a lot of similarities because I'm still just as involved as I was in every job because I'm just in there.
It's just who you are. It's
just like who I am to like be involved in all aspects and to care very deeply. There's those big feelings again.
There's those big
but
feelings.
To just care very deeply about everything all at once. But it has been an absolute joy of my professional life to get to open a facility that views and treats eating disorders in the way that I view eating disorders, to be person focused, to be truly health at every size, to be anti-diet culture, and to, pick out furniture that is accommodating of all body sizes, to like get a hand in the meal plan to accommodate, we can do vegan, we can do kosher, we can do halal, we can do all of these different things that it's just been a professional joy to get to do it. We don't have any level system. I'm really big into, do you follow Dr. Jenny?
Yeah.
WH. I'm a big fan. So she ever hears this, my girl, big fan. But I think, it's huge for me as someone that works in higher level of care to think about anti-carceral treatment and take it not as, I think a lot of times bigger treatment centers get like offended by these posts. I love it. I am here for it.
Yeah.
I'm here for it because I think I understand the harm that's been done at treatment facilities. And I think that it's life-saving work, but yes, there's inherently harm built in. And what can we do to reduce that? Yeah. And I think if more facilities took on that, and I also will never be the person higher level of care that doesn't think it's valid for outpatient teams to practice harm reduction and not recommend higher level of care, because I see both sides and I think both are real and both are valid. I love it. It's been like this beautiful intersection for me. I'm really trying to get into like, more social justice stuff in the upcoming year. So I really want to do more scholarships for folks. I really want to do a BIPOC scholarship in 2025 is up and coming. So trying to just reinvent recovery.
I was
That's my
gonna
old
say,
tagline. The shameless, my
changing the
shameless
game.
plug.
Yeah.
But
Yeah.
it's like I said, it's been the professional joy of a lifetime. Truly. Yeah.
I love it. I
A lot
think
of
you're
work,
doing
but we're doing the damn thing.
a lot of work and a lot of beautiful work. And I know we met probably like a year ago, maybe a little under a year ago, when you were first kind of like gearing up to open. And I was so excited that we were going to have, another option in Pennsylvania for young kids to really get good care.
Only adolescent specific residential in PA, and it's just crazy to me that we're the only, but like Pennsylvania has so minimal resources. It's just like, let's be small and we mind our business, and we're over here in the Poconos, and that's where I like to be.
Yeah, doing really good work.
Thanks, Sarah. Appreciate you.
Yeah, so we're so grateful you're here.
Thank you. This was fun.
It was fun. Thank you so much. And like I said, we could talk about this probably all day long.
All day. I could keep you here for hours if you'd let me.
Sometime we should.
We really should. We'll do it again.
We will. So. All right, everyone. So be sure to check out Blue Ridge. I'm going to link to their website in the show notes of this episode so you can check it out. Follow them on Instagram, all the places. Doing really great work. And
thanks.
Yeah, thank you again so much.
Thank you.
And all right, everybody, we'll be back next week with another episode. So until then, take good care.